Hi, welcome back again. This is SOFA session number 4, and I will give feedback on my own this week on module number 3. So what you had to do last week is you did an interview with a patient. You prepared the interview and had the interview itself, and based on the interview you were asked to make a patient journey. First about the interview. The questions I received, so when you do an interview with a patient, of course you have to prepare it, and you have to keep in mind what is your goal, what do you want to know. So in this case, you wanted to know more about how someone experienced the journey, their illness, what kind of emotions they had, and normally you want to use it for your design work. So you have to prepare certain topics and certain questions. And what works well when you want to know about someone's experience is that you really ask about details, because the details inspire your design, or they can inspire your design. So for example, one of the questions I saw here was, did you feel comfortable before you went to the doctor? It's a good question because you want to know something about whether they feel comfortable or not. But also you want to know why they felt comfortable or not, or what did they do specifically to feel more comfortable or not. Maybe they were looking for more information in advance. So then you know as a designer that you have to present information to them. So ask about details, ask about why, ask many questions to go deeper into the topic. That's my main advice. Then to the journey. I'll put it here. So Frauke explained in her lecture that it's good to first start with the stages and the sub-stages. There's not a good or a bad way how to do it. It depends on your own assignment, your design goal, and your most favorite way of working. So it needs to work for yourself. But I liked how it was used here with the stages and the sub-stages. So this student, she divided the journey into 4 bigger stages. First symptoms, diagnosis, treatment, and feeling healthy again. And then she defined the sub-stages. Pain during walking, for example, here diagnosis, of course, first going to the GP, then for second opinion, treatment, surgery, and physiotherapy. So stages and sub-stages, and then the most important part of this assignment about the emotions. Based on your interviews, and that's where the details of your interviews are important, you will decide in what stage did the patient feel have positive emotions and when did they have negative emotions. I always think it works well if you draw a kind of a graph. So where are the negative periods and where are the more positive periods? So in this journey, a graph is drawn. Here the student didn't, but I think it gives you a good grasp on where the patient feels better and where not. And also use some words why here for example they felt bad. I should put it also with the graph because it gives a direct link to why someone is feeling bad or not. Behavior, it's still a bit empty here and here as well, and I think that also has to do with your type of interviewing. So if you ask more about what kind of behavior did someone have at a certain stage of the patient journey, it's also easier to fill this in. And you can use quotes or you can make your own estimations. And then the insights. Insights is already the translation from emotions and behavior of the patients to insights for the designer. So what gives you little triggers where design opportunities exist? So for example, here the insights are still very close to the patient. What is it? Expecting and talking about the disease. Oh no, sorry, I changed it. So here it's very close to the patient. Searching for people to share their story, so that's more what the patient is doing. But as a designer, it can give you insight that they want to share their experiences with peers, for example. So you could set up something on Facebook that they can share their experiences. So try to describe the insights in such a way that they already give little leads for your design work. Okay, that's it for now. Good luck with your next assignment, and I will see you next week.